Your oral microbiome, a scam or a way to true health? Let's find out. All right, guys, welcome back to the Dr. Vincent Buscemi Podcast. I have a little bit of a cold. I thought I escaped it. My wife was sick for a week. My kids were sick. They took time off. Then I was fine. And then I traveled and got on an airplane. And when I came home, I have a little bit of a cold. I feel great. I'm not contagious, but my nose and throat is a little nasally. So if you can bear through it, this podcast is totally worth it. I want to talk about your oral microbiome. It's becoming a really big topic as of late. A lot of my patients are asking about it. And I think it's important that we go over the fundamentals of the oral microbiome and just your microbiome in general. This paper came across my desk. And when I say it that way, it makes it sound like I'm like a super important health researcher, truth finder, and people are just dying to get me articles, to get my opinion. What I really mean is Dr. Ellie Phillips, a good friend of mine, emailed me this and said, please read this before a Zoom meeting. So anyway, let me tell you a story about two patients that came in my practice. Wonderful people, mother and daughter combination. And they were coming to me for a second opinion about the oral microbiome and other cavities and issues they had. And I asked them if they had any oral microbiome testing. And they said they did, but after the test, the dentist gave them their results and just said good luck. And they said they kind of felt discouraged because they spent all this time and money on this test with no guidance after. And they were convinced before the test that it would give them a roadmap on what to do next to heal their oral microbiome, which I would also be frustrated from a patient point of view if a doctor ordered a test and didn't review the results with me, or ordered the test, reviewed the results, and then didn't give a roadmap for what to do next. So I do oral microbiome testing in my office through the company Swish. I'm not tied to them. I'm not paid by them to talk about them on my podcast. I'm not even convinced they're the best one, but it's what I use now. They're very customer friendly, as in like I'm the customer, so they're easy to work with. But I think if you have a better understanding of the oral microbiome, the fundamentals, and possibly what you can do to change it, you'll feel more comfortable spending $100, $200, $300 on an oral microbiome test that will help you move forward towards health. Because if you get the test and it doesn't help you move towards optimal oral health, what's the point? So let's review this article. Let's review my thoughts on the oral microbiome, and I'll take it from there. Normally I go over 2 or 3 or 4 articles per podcast. We're going to spend 90% of the time on this article, which is called The Healthy Oral Microbiome, a Changing Ecosystem Throughout the Human Lifespan. And this is written in Oral Biology and Medicine in the Journal of Dental Research. Again, riveting. So normally I wouldn't do this, but I'm going to read the entire abstract because that will give you a baseline or foundation throughout the entire podcast. So microorganisms, or the bugs, have evolved with a variety of plants and animals, developing a complex symbiotic relationship with their host and their environment. Basically, we evolved with viruses, if you believe those are true, bacteria, amoeba, everything. We evolved with all these bugs, and we actually depend on each other to live. The diversity of symbiotes acquired over time help their host adapt, survive, evolve more rapidly and efficiently, improving fitness across a lifespan. Understanding these synergistic relationships between humans and their endogenous microbiota may provide valuable information on human physiology, on the potential mechanisms associated with the onset of disease. This review summarizes current data on the composition and functionality of the predominant taxa of the healthy oral microbiome across different stages, habitats within the oral cavity. I won't read all of this, but basically, this review paper is going to go over all the previous research about the oral microbiome. Here's a very important part. Fluctuations do happen, but a resilient core community will persist over time in most humans to maintain homeostasis. Future challenges of microbiome research will rely on our ability to define age-related healthy oral microbiomes across populations so that oral dysbiosis can be detected and managed in advance. In this context, standardization of data acquisition and analysis, as well as improvements in multidisciplinary clinical diagnosis, blah, 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 blah. Okay, so basically this paper is saying we know what bugs are in your mouth, and we know that certain bugs are bad and certain bugs are good, but it's way more complex than that. It's not as easy as Salmonella causes food poisoning or E. coli causes food poisoning. We know there's a bunch of bugs in your mouth, but the core of understanding your oral microbiome is understanding, 1, how these bugs interact with each other, 2, how these bugs interact with you, and 3, what makeup or variety or composition of bugs totally is healthy. So when you look at a population of people, we'll just say, you can't just look at people at face value and say, okay, this is a safe population, this is an unsafe population. The same thing with the bacteria in your mouth. You can't just look at them, at least with the research now, and say, okay, this type of oral microbiome makeup is indicative of health. We have some evidence of it. It seems the more diverse your oral microbiome is, the more resilient it is, and the more healthy it is. So we're going to run through this whole paper, but just a warning that if you have a dentist or even a physician that tests your gut microbiome or your mouth microbiome and says this one supplement will give you this one bacteria, or this one supplement will get rid of this one bacteria, it's not a one-to-one relationship between this one bacteria and disease. In this book I have, I'm not sure if I can hold it up to the camera, Heal Your Oral Microbiome. I know most of you just watch the audio or listen to the audio. The author talks about that strep mutans, which more than likely is one of the main drivers in cavities. Some people have no strep mutans and still have cavities. And some people have a lot of strep mutans and don't have cavities. So it's important to look at the entire composition. Okay, here we go. So it's going to go through basically how our oral microbiome develops over a lifetime. And I will make this super exciting. Okay, types of delivery, vaginal versus C-section. Let me tell you this. I have 4 kids. I did not deliver them. My wife delivered these 4 kids. I know how hard it is to deliver kids. I'm not passing judgment if you delivered vaginally or through C-section. I'm just telling you what the science says. Because remember, the truth will set you free. And knowing the truth is not me casting judgment. It's just showing you what the truth is. Okay. In vaginal deliveries, the close contact between mother and infant suggests that maternal skin and gut microbiota are potential sources of oral microbiota. What does this mean? When the baby's delivered, it can either get the bacteria from the mother's vagina in their mouth, or can get the bacteria from the mother's skin in their mouth. And then it says, in contrast, a cesarean selection or C-section delivery introduces microbes from the maternal skin and the hospital environment as the initial colonizers. Studies have shown that saliva from vaginally delivered infants exhibits greater microbial diversity and a close resemblance to the mother's salivary microbiome compared with infants delivered by C-section. What is this saying? When a baby is delivered naturally, we'll just say, because I'm not going to say the word vaginally 100 times in my podcast. When the baby is delivered naturally, not C-section, the bacteria in the baby's mouth more likely resembles the bacteria from the mother's mouth. But when the baby is delivered through C-section, the bacteria in the baby's mouth more likely resembles the bacteria from the mother's skin. And then the scary part is the bacteria from the hospital environment. And you know just how dirty the hospital is. So, from a purely scientific standpoint, a baby that is delivered vaginally has a higher microbiome diversity in the mouth and a healthy oral microbiome. I do want to say before we go through the rest of this, it doesn't mean you're screwed. If you have to have a C-section, you have to have a C-section. And there's ways throughout your lifetime you can still improve your oral microbiome. In the book I was reading, I showed on the screen, How to Heal Your Oral Microbiome. I've never heard of this before, and I don't recommend it. But there's something that some of these moms do that are called vaginal seeding, which if you have a C-section, you actually take a cloth and rub it on the mother's vagina, and then take that cloth and rub it in the baby's mouth. And that's supposed to move the microbiome from the mother to the baby. I'm not recommending that. I just thought that was odd. I guess logically it makes sense. I've never done it. I'm not recommending it. Consult your very holistic, functional medicine skeptic doctor for advice, because I promise no hospital's going to let you do that. So, the early acquisition and establishment of the oral microbiome are also affected by continuous exposure and transmission to the mother's oral taxa to the child. So, this is interesting that the baby's oral microbiome is more related to the mother even if the child is adopted. So, this is more evidence that it's not so much genetics that play a role in cavities and and gum disease, although I think it is some genetics. It is also just the environment they grow up in. So, types of feeding. Again, I have 4 kids. My wife breastfed all 4 kids for a year, maybe more, and even breastfed both our twins at the same time for more than a year. However, not every woman can breastfeed. I'm not judging. I've never breastfed. It looks hard, but not every woman can. But just based on the science, there is a clear distinction between the oral microbiome of breastfed babies and the oral microbiome of formula-fed. And what's crazy about breastfed babies is that the breast milk is like a intelligent design where the saliva from the baby gives information to the mother, and the composition of the breast milk changes and delivers to the baby what's needed. I think formula is a scam. However, if you can't breastfeed, what options do you have? I don't know. But let's just talk about formula. So right here, breast milk components include immunoglobulins, so IgA, and immunoglobulin G, IgG, which is crazy because these immunoglobulins actually inhibit the growth of certain bacteria that can cause cavities. One of them is strep mutans that we talked about earlier. So when babies are breastfed, the breast milk gives them antibodies that can fight off the bacteria in your mouth that have a higher risk of causing cavities. And formula-fed babies don't have this. It's just the miracle of breastfeeding just blows my mind. That is basically everything the baby needs. So after delivery, type of feeding, there is another clear distinction between breastfed babies and formula-fed babies. The differences in the oral microbiome composition between breastfed and formula-fed are observable and most pronounced during the first 2 years of life. Which means if you're not breastfed, you're not screwed the rest of your life. It just gives you a really good starting point. And another thing from a airway, because I'm very interested in both airway and oral microbiome, breastfed babies have a more developed maxilla and mandible or jaw, which correlates to a better airway. And that's for another podcast. So next, introduction of solid food. Introduction of solid foods, typically occurring around tooth eruption, significantly affects the oral microbiome, possibly more so than eruption itself. Solid foods provide a variety of nutrients for the microbiome community. Basically, feed your kids solid, real foods at about a year when they can tolerate it. We did our best with this. We did feed baby food, but my wife did a really good job at cooking food at home and feeding it to our kids, at least the older kids. By the time we had our twins, they were eating like slushies and popcorn. I'm joking, but the more kids you have, this is difficult. But it shows in this article that the more real food you introduce to your babies, the better and more diverse the oral microbiome. This is called baby-led weaning, where basically you feed your babies the food you're eating, but do this if you're eating real food, real, holistic, organic food. This is difficult. It is so easy to buy baby food in those pouches and feed it to your kids, but the science says don't do that. And also, the baby's jaw, maxilla, and mandible develop more fully when they chew more. So that is another point you should look at when you're raising your kids. Are they eating real foods? The reason why I'm going through this whole list is I want to show you just how foundational and all-encompassing altering your oral bacteria is. It's more than just taking an oral probiotic, which may or may not work, or brushing your teeth. You have to take an actual holistic, comprehensive view of everything. Moving on to adolescence. This is funny. So, hormones affect your oral bacteria, your mouth environment. And this is just a cruel trick played by nature. But because of all the hormones as a teenager, there is a higher risk of certain bacteria and interactions happening in a teenager's mouth, which are linked to odor, malodor, or bad breath. If pimples and squeaky voice, which mine's squeaky now because I have a sore throat, and anxiety and sweating isn't enough, just being a teenager, you have a higher risk of bad breath. I don't know how kids make it out a teenager. Puberty. Puberty is like hell on earth. Anyway, hormones change your oral bacteria. So look at this. As an adult, understanding the beneficial role of the adult microbiome goes beyond describing its composition into revealing its functional activities and interactions with the host. Basically, you have to understand how the entire oral microbiome functions to see what is a healthy oral microbiome and an unhealthy one. One of the things that's very important and why I think pursuing a healthy oral microbiome is so important is because there's a conversion of dietary nitrate to nitrite, which is then converted to nitric oxide in your mouth. And then nitric oxide reduces blood pressure, improves vascular function, and shows antimicrobial activity against periodontal pathogens, contributing to oral and systemic homeostasis. So, the healthier your oral microbiome is, the healthier you are overall, and can reduce your blood pressure. There was this study, I don't remember when, I didn't even read the study, but I heard it on, I think, the Huberman podcast, that using the wrong mouthwash can destroy the good bacteria or destroy the homeostasis of bacteria in your mouth, which can lead to high blood pressure. So, here's very important. Based on the available literature, however, one may argue that strategies for maintaining commensal species involve the nitrate reduction, which is the nitric oxide to low blood pressure, arginine metabolism, which leads to lower cavities, and anti-inflammatory and immune-related process throughout aging, are more likely to promote beneficial effects associated with oral health in aging people. So, it's very important to understand that there is a connection between your oral microbiome and health. But it's also very important to understand is it's still in its early or infancy stages of research, and it's not well documented what it takes to have a healthy oral microbiome. So we have to use a little bit of logic and what's called inductive reasoning, where we have to take some understanding of what it takes to have a healthy microbiome and what it has to take a healthy overall physiology and apply that to your oral health. Because I would be scamming you if I said there's one probiotic you can take that will change your microbiome, that will make you healthy and stop having cavities. I think you have to hit your oral microbiome from a comprehensive point of view. When I was talking with Ellie Phillips, we had lunch together in Austin, and she said that some people's oral microbiomes are so bad that a lot of these holistic, comprehensive measures don't work as well as targeted pharmaceutical measures. Because if you look at her complete mouthwash system, it's not organic. It's not holistic. But she's convinced, or not convinced, she has seen in patients it does reverse dental disease. I have a lot of patients that do her protocol. I also have a lot of patients that won't touch anything unnatural. So if you are not for unnatural pharmaceutical remedies, I want to go through 7 ways you can holistically heal your oral microbiome. Number 1, and this is kind of the drum I beat all the time, eat a whole food, diverse diet. Avoid processed food like the plague. In 2013, 2012, something called the Paleolithic diet became very popular, and then it changed to the carnivore diet, and then it changed to an animal-based diet. I think the diet you eat, the longer I live and the more I study this, I don't think macronutrients matter. I think you can eat high carb, or you can eat high fat, high protein. I think what matters the most is you have to look at diet through a ultra-processed to unprocessed spectrum. And the more your food lean towards a ultra-processed composition, the more unhealthy you will be, and that will negatively affect your oral microbiome. The second one, you have to consider the rhythm of your diet. Dr. Ellie Phillips calls this mouth resting. Other people call it intermittent fasting. But humans were not designed to consume all day. Even just water. There has to be periods where you don't consume anything. You just sit. Don't sip water all day. Don't chew on organic food all day. I mean, take 8 hours off. Your system is designed to not eat all day or drink all day. Avoid snacking all day. Just rest your mouth. The second thing is avoid alcohol and smoking if possible. It's possible. Just do it. If you are trying to quit smoking, this is for another podcast, but I've been doing a lot of research on nicotine and how nicotine's not addictive. It's actually other things in cigarettes that are addictive. That's why you'll never hear anyone that successfully quit smoking because of nicotine patches or nicotine gum. Anyway, alcohol and smoking dry out your mouth. And the drier your mouth, the less diverse the oral bacteria in your mouth, the more bad bacteria that thrives, and the more risk for cavities. The fourth one. This is huge. This, I think, is the root cause of most dental problems. Airway. Go to a dentist that will do a cone beam CT that will evaluate your airway. And then go to a dentist that is trained under a dentist named Felix Liao. Felix Liao is training dentists in what he calls airway mouth doctors. And they are trained to help expand and redevelop, even in adulthood, your upper and lower jaw to open up your airway to get better breathing. Because the more you breathe through your nose, the healthier you are. The next one, that's why I had this article up, is you need to really hone in on your sleep cycle, your circadian rhythm. This article is Circadian Clock, a promising scientific target in oral science. Look at this. Right here, there is a connection between right here. The oral and maxillofacial region and the process of oral-related systemic diseases sums up the chronotherapy and preventative measures for oral-related diseases based on changes in tissue activity, basically, circadian rhythm as a kid affects the growth and development of your jaws, which leads to a better airway, which reduces the root cause of your dental diseases. And the second article is disturbances in sleep and circadian rhythm affect saliva production, which impacts the development of dental caries, as saliva is necessary for regulating and maintaining oral health, especially for controlling oral infections. A person's preference for a particular time of day depends on circadian rhythm. Basically, if you improve your sleep, all of your life will improve. From an oral standpoint, a bad sleep rhythm or a poor circadian rhythm actually changes the composition of your saliva, which will increase the chance of cavities. And if you have a poor circadian rhythm or poor sleep, it actually changes your behavior, which drives you more to eat processed and sugary foods because you're searching for dopamine. The sixth thing you can do is chew xylitol gum. I buy Zellies, which is Dr. Phillips gum. Xylitol will help move your oral bacteria towards a more beneficial oral bacteria. And the last thing, which seems like common sense, but I remember in undergrad, I kept my toothbrush right next to the toilet. Keep your toothbrush as clean as possible, because part of the oral disease process or part of the cavity process is that bacteria is transmissible, and dental cavities is a bacterial disease. So if you have a dirty toothbrush, you're putting dirty bacteria back in your mouth, and it will shift your oral microbiome towards a more unfavorable state. So in conclusion, it's not one bacteria that causes disease. It's the whole makeup of your oral bacteria. And you have to hit it from a holistic, comprehensive point of view. I can't drive this point home more than there's not one thing that will fix it. There's not one product you can buy. You have to treat your oral microbiome like your gut microbiome, like your health. There's different things you can do to improve it. I'm sorry if listening to my raspy voice was a struggle, but I really wanted to get this podcast out because I'm traveling again next week, and it would have been another week or two before I got this out. I really appreciate you guys listening, and I'll see you guys soon. Bye.